Shalom, everyone. This is Robert Dorfman. I am the president of Hadassah International, and I'm joining you from my home here in Hong Kong. And it's wonderful to see so many people on the call today. I'm particularly pleased to be able to do the introductions this evening, my time, because one of the two participants is Dr. Esti Galili, who I had the great pleasure of hosting here in Hong Kong 3 years ago, where she spoke at the Hong Kong Jewish Community Center, as well as speaking to a large group of pediatricians here in Hong Kong. So it's wonderful to see Esti again. She was on her way to Australia as a guest of our Hadassah Australia colleagues, where she spoke to quite a few groups and did some wonderful work in promoting Hadassah in Australia. Esti, of course, is the director of the Herman Division of Child and Adolescent Psychiatry at Hadassah Hospital in Kerem. And she will be joined today in this session by Dr. Claudio Michanie, Chief of the Child and Adolescent Psychiatry Section at the CEMIC University Hospital in Buenos Aires. Before they start, I'd like to turn it over to our Associate Director, Jorge Diener, to run the session today. Jorge?
Thank you, Rob. It's a pleasure to have you hosting this event. Under your leadership, we have organized this Hadassah International Summer Summit Health Talks with Hadassah experts and our friends from all over the world. And it's a privilege to have for this event, of course, Professor Esti Galili, but also Dr. Claudio Michanie, who represents our brother or sister organization in Argentina, the Hospital CEMIC, our strategic partner in Argentina, and it's the first event actually we do together, Hadassah and CEMIC, and the framework of this strategic relationship, and we are very happy about that. And when I say we're very happy, I just want to say 2 words about the feelings that I think are going to be covered through this session. I think it's very exciting after we have been talking through a series of webinars at Hadassah International about COVID-19, about the pandemic and the functioning of the virus and the infection and how to prevent and how to manage and how to run all the different type of elements of this health crisis. There is one thing that we need to look very carefully, and it's mental health, because it's a challenge to think about all the uncertainty we are living with. And you know, when I was looking again at the title we created for this event, I thought about 2 things that I want to leave open for both of you to talk about and discuss. One is we talk about post-trauma, and I think, you know, what is the word post doing in this post-trauma when we are in the middle of the trauma? This is not after or before, it's an ongoing situation. And second is the word anxiety, and what happens when anxiety is not an individual issue, but it's a word that lives in the anxiety of not knowing what's happening and where we're heading. And I think, having said that, the floor is yours, Dr. Michanie, please.
Okay, thank you very much, Jorge. First of all, I would like to thank the organizer for inviting me to this event. By the way, I would like to know that our chief of department, our chairman, did his residency in Hadassah in Kerem. Well, you know that since the pandemic, the COVID-19 began, we are facing all severe, difficult challenges in our practice as well as in our personal lives. In my country, the lockdown has started more than 100 days ago, causing serious problems in the mental health care of our population and the economy. Reports of violence, for instance, reports of violence against women increased by 40%, and those of child maltreatment by 100% so far. Most public and private clinics do not accept in-person consultation and switch patient care to online platforms. As a result, the number of first consultation and follow-up visits has dropped significantly in our practice, as in almost all medical specialties, reducing them to severe cases of psychiatric emergencies. We are witnessing a worsening of depressive symptoms and many relapses and recurrences of mood disorders in our patients. Also, we have seen an increasing rate of self-harm behaviors in adolescents, both non-suicidal and suicidal. Also, as the lockdown time is extended, we are seeing higher levels of stress within the families, with many children showing adaptive reactions associated with behavioral and mood problems, and a worsening of symptoms in patients with pre-existing panic disorders, generalized anxiety, OCD, and hypochondriacal concerns. Interestingly, we are seeing some improvement in children with separation anxiety disorders, social anxiety, and high-functioning autistic patients, and also in children who had been, before the lockdown, who had been suffering from bullying at school. Regarding our adult patients, almost all have switched to online treatment in our population at CEMIC. In a survey we have done, we detected about 20% of moderate to severe depressive symptoms, about 36% with mild symptoms of depression, and 50% of our population, not meaning patients, but our population that are affiliated to our hospital, referred feeling anxious. In the last week, we are receiving many consultations with adaptive reactions due to economic impact of the lockdown, I mean in our adult population. Regarding our health workers, our department has launched a crisis intervention program, and most of the cases we are dealing with are related to adaptive reactions. It's an honor for me to share this event with Dr. Esti Galili, who is a well-known expert in our field with a deep knowledge of trauma and PTSD in children and adolescents. Dr. Galili collaborated with the healthcare system as an expert of countries that experience natural disasters like the Mexico earthquake and the Sri Lanka tsunami. So we are eager to listen to her presentation. Dr. Galili.
Thank you very much for creating this international forum of sharing experience, I would say more than knowledge, about this ongoing situation. And if anything, I'm extremely humbled that all of you put the time to join together and think together. I may disappoint you because I have very few answers and more thoughts and maybe experience. Where I do fall back on something, and maybe I would start with that and go back to that after, is the experience of being a therapist when you're also part of the traumatic event. It's not that you're being secure and comfortable and your patient experienced something and you're sitting comfortably and offering your knowledge and medical treatment. You are actually experiencing the same thing that your patient or client is experiencing, and you have, in a way, to remain in and out of the situation. I'm not talking about split, I'm talking about integration of a personal experience and a professional position. But I have about half an hour, and I'll try and give a little bit of a talk, but I'll see how we'll go. So the basic thing is that our psyche, our collective unconscious, knows disaster. It is a human experience. of all times and well documented. If we start with the great floods, with the great flood in the Bible, and these disasters basically threaten to extinct the human race. So we all know that that's a possibility. The other thing is that our collective conscious, our collective historic memory knows about other pandemic episodes. And for instance, in all countries, we related to the Spanish influenza, what was called, in the beginning of the 20th century. And I was very amazed that the first lecture that we had during Corona time on a Zoom event was that the chief psychologist kept again and again and again referring to that event. And in a way, I think none of us experienced it at first hand. We're all younger than that. And it's not the same. It really isn't the same. We're in a different world. But the experience of that, something that is out of our hands, out of our control, is threatening to erase us from the face of earth, is probably a very fundamental psychological anxiety. And if we go back to what is separation anxiety, basically, symbolically, that's what it is. So when we're threatened, we respond with panic and with humility. I mean, it's very easy then to manipulate us. And many leaders, or you can even say some people that believe in God, become like totally empowered, and we wait for any word that they would say, and we just will follow. They would tell us to stay at home, we'll stay at home. They'll tell us to wash our hands, we'll wash our hands. If they would tell us to wear green hats, we would wear green hats. At the beginning, we just want somebody to lead us and to tell us that he knows what to do. I think at the very, very beginning, we were frightened, but we also trusted our leaders. I think what happened slowly, and in many places in the world, is that that kind of trust in our father, in our leader, in our protector is somewhat diminished, and psychologically it weakens us. Again, it is complex. It doesn't exactly weaken us because it forces us to take action individually, but it is an issue. So collectively, we know that there's a disaster, but collectively, we also know that we have a chance to be saved. Hope is also a human, natural drive. Again, the big flood, many died, but people and animals were saved in Noah's Ark. So we have a very deep-seated belief that there's a chance that we will survive. I will even go to the Holocaust experience. People had hope. They were going through, I don't have to tell any of the people that joined us, through horrific experiences, but they do have psychologically, most of us have hope. And that hope is very, very important for our ability to respond, to function, and actually to take care of others. And if, we could say anything about leadership, a leadership that can give hope to the population is very crucial. Now, let's go 100 and something years ago to Freud, who said, what is mental health? Mental health is the ability to love, to work, and to play. This pandemic has certainly damaged most of the population's ability to work and to play. We can talk about love in a different time. And another way to look at mental health is the ability to be flexible and to be creative. And when you are experiencing a threat, a real threat, these abilities to be creative and to be flexible is diminished. And you kind of freeze and you become stiff. And as we are experiencing a collective trauma, instead of being creative and flexible, we turn rigid. So obviously there's elements of acute stress reaction, I would say more than trauma. And a lot of us were, at least now, maybe it's a bit better here, but I don't know in other countries, over watching the news. That kind of semi-addiction, as if I'm in control, if I overwatch the news, is another symptom of actually being in an acute stress reaction. It's the inability to focus on something else, the inability to get out of that mode of survival, immediate survival. And so as if it calms me down if I get information, but in fact, it doesn't really work that way. It works like that for maybe 2 minutes. And just to start, and just mention now what we recommend to the population is certainly to protect young people and children from overwatching the news and all that goes on. Now, another thing that a lot of us adopted kind of compulsive behaviors of checking and rechecking. Did I wash my hands? Did I clean the bag from the supermarket? Did I wash the vegetables? Did I touch that doorknob that somebody else touched before? Did I clean the table good enough after the patient sat on it? And I can go on and on and on and on. And in a way, again, like OCD works, at first it calms you down because you feel in control. Afterwards, you really lose any kind of ability to think straight. I would say the experience, in my mind, is like being a juggler in the circus. So he starts out easily and with a smile with one ball, and somebody throws him the second ball, and then he's got the third one. But then more and more balls keep being thrown at him, different sizes, not in an ordinary rhythm. Sometimes somebody takes the ball out, sometimes somebody has 2 balls at a time, and he just has to keep them in the air all the time. So we have, as professionals, to make decisions in a changing reality. It's not that I know that the reality is like this and I have to adjust to it. I'm adjusting to one thing and then I have to change. You were telling about Argentina that you're in a way in a quarantine for 3 months, which is horrible. And we had a much shorter quarantine, but we're out and then we're in, and then every 3 days or every 2 days, the instructions change. And what we experience, which is something that actually contributes to our insecurity, is a loss of control, and which is true. We do not control the situation. We cannot control the situation. We have to focus on the very few things that we can actually control. And we don't have control, but we do have a responsibility. We have a responsibility for ourselves, for our family, for our work, for our patients. So how can you hold on and function with that without having the other? And so as being in charge of our child psychiatry unit, and this is really focusing on us, which doesn't mean that other people's experiences are not as complex or meaningful. It's just giving one example that will just to share with you. First of all, I had to give work instructions when I didn't have clear, any clear idea what would be right. For instance, just one of the dilemmas that kept me up at night was that at a certain point, we had an okay to deal online from home. The psychologists could work from home via Zoom, but the secretaries had to come to work. So I had to force the secretaries to come to work, even though we weren't sure that they were being protected from getting infected in the hospital itself. Because without the secretaries, one is they did not have a leave from the hospital administration. Second, all the meetings had to be coordinated via the secretaries. So the daily responsibility that I am in a way forcing them to come physically to the hospital, to walk through the corridors, and right above us were the two corona inpatient departments. Then you had to be very in tune with your patient's needs. What would be right for them at this specific time? And I'll talk about it a bit further. We wanted to give service. We wanted to open our service, so a hotline for the people of Jerusalem, and later on a hotline for the hospital workers, mainly in the corona department. And I'll just start now by saying that the hotline didn't work as good as we wanted to. What worked better is when we went physically to the corona department, we went into the staff room, we sat there and we said, we're here to talk to you. They don't have the energy even to pick up the phone when they are at home to talk about what they're going through. When we physically sat in their staff room, when they came in just for a drink of water, we could say, please sit down for a minute and talk to us about what's happening. So you're trying to do that. And I'm not being politically correct, but I'm a director of a department and I want us to live. And I'm worried about what cuts are going to hit after this pandemic is over. How am I going to save the positions of the people that work if we don't work during this time and we don't see patients? So at the back of my mind is, are we generating enough income for the hospital? So this is obviously not the first priority, but it's there. So we're going now into, I don't want to go into my individual experience. And you mentioned before that each of us has the personal struggles and so on and so forth. But I'll just mention that I which was very, very meaningful and fantastic, but I had two grandchildren born, one in Amsterdam, one in Israel. It's not simple in Corona time to be in the delivery room is one thing, not for the mother. And I have a very, very old mother. I'm fortunate, she's over 100 years old, but it's a real challenge, what you can and you can't do. But this is just, each and every one of us has his own experiences. But, so we're going into what we do in our work. First of all, we have the emergency room. So as the first 2 weeks of the quarantine were happening, it was very easy to work in the emergency room because patients were too scared to come to general hospitals. So that was easy. But once they got used to the situation, the cases that come to the emergency room are very demanding, very severe. Jorge, you mentioned it. child abuse, self-harm, extreme physical conflicts at home, and all that. And you have to see them with a mask. Usually, child psychiatrists work even without a white overcoat to make the children feel more comfortable. At this time, in the emergency room, we have the whole gear with a mask and with a screen. And it's certainly not the most intimate way to evaluate someone that you've never met before. So from there we go into, now, don't get alarmed, I have an allergy. Sorry. So we go into our inpatients. Our inpatients are basically, we have 14 adolescents. We had to close the doors of the ward. They stayed in, no visits, no school, no visits, no psychologist, only via Zoom. So in a way, the children for 2 months hardly didn't see their parents. The second month we started from time to time. I must say we were very lucky. We didn't have any extreme consequences, but it certainly was a challenge. Part of the time, one of the doctors caught the coronavirus from an anorectic patient who was exposed to her aunt, etc., etc., etc. I don't need. So all the doctors from the inpatient were in quarantine, 2 head nurses, and we had to shift with other doctors. The day treatment we have for adolescents is based on group therapy. That's the main thing that we offer. Obviously, we have individual therapy, but what we believe that works the best is the group. The parents and the patients wanted to come. We couldn't see them. So we had to create, from the one big group, we had to create 3 different groups on 3 different days. And again, at first you're in emergency mode. So everything is working fine because everybody is at their best. But after a while, it doesn't work as well. Then we go into our outpatients. So there, as I said, we worked on Zoom. A lot of our psychologists were at home, either because they were in quarantine or because their children didn't have school. So now is another challenge. Not all the children have what we call smartphones. A lot of the ultra-Orthodox, a lot of the very poor Arabs just don't have the technology. So Zoom is irrelevant. Then, do you really have a privacy? Do you really have a room where you can, like we do now, close the door and ask all the family to be quiet? Most of our patients don't have that. So how can you have a therapeutic session with 2 brothers in the room and your mother dealing with 2 other children in the living room? So that's one thing. So, and then the psychologist herself can't work in the regular hours because her children are awake. So she might move it to the evening. So with all that, and all of a sudden, you're seeing the psychologist's house. You're seeing my bedroom in the background. And we're not anymore the anonymous therapist. We have a life. And you hear a child cry, and sometimes you hear somebody fight at the other room. So all that is another thing. Now, some adolescents like flexing their muscles. So, okay, I'll talk to the Zoom, but I'll shut and you won't see my picture. Or I'll put all the funny little animations on my, how can you do therapy that way? What kind of intimacy? And when we started seeing patients again physically, children play with toys. How can you protect them from infecting and getting infected? So we ask children to bring toys, crayons from their own home so they could play with it, and then they would take it back with them. We had to stop for 2 months during diagnosis. We started again now, but we'll stop. And doing our professional meeting via Zoom. So at first we were all thrilled. This was a wonderful solution and we can do everything, but it's not the same. I think you all experience that you cannot have the same kind of discussion. It doesn't work for everybody. Not everybody can concentrate the same. It does maybe save some time, but the effect is limited. And what worries me in the future is that telemedicine has got a tremendous push during this pandemic. Most countries, health is not the highest priority. They want to cut down on health and certainly on mental health in all countries. This certainly cheapens the services because you can as if provide the same kind of service, but it isn't the same. If there's nothing better, yes, it is important to do telemedicine. But I do think that to throw out the interpersonal experience of sitting at the same room together is totally, totally irresponsible. And we should be aware that that might be the backlash of, you can work from home. This is a solution. Now, obviously, we see, Jorge, what you said, but with all the examples, but I just want to even be more dramatic, even for a healthy adolescent, to finish high school without a ceremony, to have his fantasy about the love object not happen, and to lose the security about whether it's really going to happen or not. There were a lot of sleep disorder problems that surfaced and were very, very difficult to treat because children and adolescents changed their sleep time and stayed connected to their phones and to their screens all night. We talked, you mentioned violence, the rise of violence in the family. We had a significant rise in women being, as you mentioned, being killed by their spouses. At first, anxiety reacts by being as if normal, but now there's a resurfacing of self-harm. And there's another phenomenon of stigmatization. In Israel, two populations are the highest in catching the virus. It's ultra-Orthodox and Arabs. So in a way, a lot of people hesitate about meeting, evaluating, or treating at the same room anybody who comes from that background. So again, we're stigmatizing people according to their social place. Now, I want to be optimistic for a minute. There was one study, there's a problem with studies that are being published now because we're all in the middle of something that's happening. We're all extremely, extremely subjective, and we're all extremely eager to share knowledge. So I think it's important to share the knowledge. It's important to know that it's a suggestion. It's something to think about. It's something to look for, not to look at it as a solid fact. But there was a decrease, that's optimistic, a decrease in postpartum depression. And I think that I understand that one of the reasons are that actually mothers stayed at home in their own natural cocoon without any need to go out and function, or the husband going out. So in a way, it was a protective environment, at least for the beginning. Not that's one thing. On the other hand, and again, young children, ages 3 or 4, a lot of more at-home aggression. Now, I would like just to end with 2 words about resilience. As I started, hope is part of our psyche. it's an instinct. The concept of the wounded healer, back from the Greek mythology of Chiron, we all can treat people and offer guidance and support and containment, even in dire times like this. And we do have something to share. We do know that however hard this will be, it will end. This pandemic will end at some point. So thank you so much, and I'm eager to hear your questions.
Thank you, Professor Galili. I think, you know, it's a fascinating topic to think about. One thing you mentioned at the beginning, speaking as a therapist, and say, you know, giving giving some framework also to any therapist, you know, in mental health, of the not with this being an in and out experience, or, you know, integrated. And I think, you know, I was thinking from the side of the non-therapists, you know, that, you know, many in this audience, you know, who look at this situation from the perspective of in many cases, parents of children and adolescents, and children of parents who are in this case also at the high risk group. No, so it's a kind of like a very mixed situation where, you know, what you mentioned about the therapists that need to look at this from the situation where he's also part, or he or she's also part of the traumatic experience. And, you know, I think here is how you deal with all these different generational challenges that are sources of different anxieties, and really breaks the traditional role of who is caring for who and who is worrying for who. So I think that in that sense, I know Claudio and Professor Galili, you know, your perspective on this. So how to dance that kind of like intergenerational challenge, I think would be interesting to hear.
Claudio, you start.
Well, it's I think it's very difficult to manage this. There are many problems with adults that are isolated at home. I mean, people over 65 years that are most affected by the bad outcome of the COVID, of the disease. And we've seen people that are suffering from isolation and getting extremely bad in terms of mood, of their mood, due to the isolation. So I think it's advisable to get that people connected with their via Zoom, via web, with their significant family. And I think if they are doing some kind of support therapy, probably the increase of the frequency of the sessions, I think could be a good idea. By the way, I'm not seeing my grandchildren since 4 months. The last time I saw them was 4 months ago. So probably they are going to be in college next time I see them.
I want to add to what you're saying. I think that there's some like different elements that play. Yes, our therapy is more supportive and more psychoeducational these times than on regular times. This is maybe our main tool. The other thing is giving validation to what our patients feel, and in a way normalization of their experience. It's very important. And the other thing is, what I try is when I'm in the session, you can use kind of other terms that come from the world of mindfulness, to be at the moment, to saying, now we're meeting, let's talk about that. I know what's happening outside in the world, but we have to try and just for a short amount of time, be here together and discuss things that you experience without any kind of guilt or discomfort, that you're talking about your little romantic affair when your mother is at home for 3 months and not seeing anybody. So it's important to give, again, support, validation, legitimization, and normalization of the feelings. And yes, when I see patients, it's not so simple for me nowadays. And some of the patients I see physically 3 meters apart, we are allowed to without masks. But it's not simple. And most of them, to treat them again via telemedicine is good, it's not the best.
There is a very question here in the chat. Somebody's asking, how can people deal with long-standing fear of death? In this case, own death and death of our beloved.
Well,
that's a difficult one.
Being with a long-standing fear of death is like a chronic situation of stress, and that means that makes you very vulnerable to mood and anxiety problems. Maybe I would like to hear Dr. Galili regarding stress and ongoing trauma situation.
I think, again, it very much depends on the person. I think that sometimes we offer medication when we can't offer anything else. The thing is, for me, what we try a lot is to encourage people to do anything that's extracurricular. We encourage people that feel high amounts of stress to do sports, even at home, to dance. People don't like sports, forget it. I'm not a good person. I don't like running. I mean, I hate any kind of physical, but dance. You don't want to dance, just listen to music. Just listen to music. That would make a difference. Watching television, but they say that I phase out when I watch the news. We're saying that doesn't count. That actually increases your anxiety. But to channel the brain to something else. If you can paint, fantastic. But again, the minimum is to listen to music. Hopefully rhythmic, so you would move with it, but any kind to space out. But for ongoing stress, and we're going back, we encourage people to be active politically, socially, but all these things are very limited nowadays. So it's hard for me to encourage that. We try to encourage creativity to work against the stifling and rigidity that happens in ongoing stress. We try to build a different narrative so it would give hope. But again, as it's happening now, we can't be, I'm thinking about a nurse that caught corona, and I'm sorry and her own husband passed away during this pandemic, and she had to leave her 5 children at home without any attendance. So you can't just be unrealistically hopeful. So you have to be in tune, and you have to think, what's the very little thing that would give her an ability to relate to her children and to bring a little bit of comfort to herself.
Yeah. And also, at least in my country, where it's such an extended quarantine, you have to change the pieces of advice from time to time, because people get tired about doing sports, about dancing, about singing. So you have to change your advices every time.
A lot of people cook. A lot of people turn into cooking. Whatever works. Whatever works.
Yeah, I think this basically, there was a question, and I think it's just without listening to the question, it's just answer, which is what is kind of the advice for adults who are isolated at home, and what are some things that adults or anybody who is isolated can do. And I think you just gave an amazing menu of options, and I think creativity is the word. We do something creative. And it's creative because you do, or creative because you listen to creativity of others, or you look at that. But just it's difficult, I think. Yes, Professor.
And another thing that as we're talking, we're trying is to say, try, because of creativity. You reminded me, try and do something new. Like, you're used to doing this and that, maybe you'll use this time to do something new and find with a person what it can be. Try and learn how to knit. Try and whatever, make, again, I'm going paint with watercolors. It doesn't really matter. Make papier-mâché. It doesn't really matter what it is, but learning something new immediately works on opening channels of positivity in your psyche. So if it's possible. Sorry for...
No, that's, everybody wants to hear you. You both, Esti and Claudio. I think, there are a few other questions, but, we should wrap up soon. So I think, it's what the advice that you have given and the experiences you share, I think are giving us a chance to make sense in some way of the reality that we are going through. And I think, I really like the approach that you both took, saying, you can't deny reality. The reality is very challenging, and the reality is very dynamic. And, as you both said, we know more or less what kind of reality we're facing in the next couple of days. We don't know what's happening in 3 days. I'm going to be able to go to work, children will be at school, somebody might be infected. It's a very fluent reality that we have to live with. But what we can do, and I think that's what you propose, and I think it's very, as much challenging as interesting, is to try to build in somehow our own experience of how we deal with this reality. And I think that's something that is in our power. We can't change, some people say, oh, but why, governments are doing this or that, just as if they were guilty for the existence of a virus that is infecting so many people. And I think, it's kind of like a scapegoat attitude, but at the end of the day, there is some things that are in our power. And I think, I know there are many mental health experts in this session, and I think the more you help us, those of us in the world who are not, to try to build that experience now and try to make sense in a positive way, so we can, because as unfortunately, this is not something that looks like it's going to disappear in the very short term. It's something that we have to live with for a longer while, and we don't know for how long, but it's for some more time. And the more tools we have to make sense of this and to help those around us to make sense, those of us who have children and people that are in our care, I think that it will be very helpful. And I think this everything that you mentioned, it's really very helpful. So one last comment that each one of you want to make before we close the event, please, Claudio and Professor Galili.
There's only one thing I would like to say before finishing the event. There is our children, our patients are living in a very stressful situation, and their parents are living in a very stressful situation. Those who have, who still have work are overwhelmed with the telework and with the supporting their school children, with the homeschooling, etc., etc. So it's very, at least for me, it's very important to help them lower the expectations, to be less demanding about themselves and about their children. And it's time to be extremely empathic and sympathetic with the situation of the families.
I just want to tell you that I really appreciate that you put the time to join us, and I wish I could hear more from you. But Claudia, I thank you very much, and Jorge, really, it's an honor and a pleasure. And I hope we all will survive and get somewhat stronger from the whole experience. And I hope your grandchildren recognize you after the 4 months.
Thank you. I'd like to invite Dr. Pablo Rozic, from the chairman of the psychiatry at the CEMIC hospital in Buenos Aires, Argentina, representing our partner in Argentina, CEMIC, to greet the group and say a couple of words. Pablo, let's unmute. I think you will probably, Pablo, where are you? If we can unmute you. Oh, just got disconnected, I think. You were connected, having some internet problems. Ah, here you are.
Okay.
Okay, Pablo, please.
Thank you, Jorge. Thank you, both of you, for the excellent presentation, Dr. Galili, Dr. Michanie. Here at CEMIC in Buenos Aires, we are very happy to be able to share this webinar with our, I will say also, older brother, Hadassah, where I have to say I finished my residency a lot of years ago, and I have excellent memories about that. Let me say that here at CEMIC in Buenos Aires, we are extremely grateful to Jorge Diener for his endless energy and effort for building a strong bridge between our two institutions, also with the help of Fanny Ribac here in Buenos Aires. It was an excellent presentation. I think that we will try to continue this relationship between our two hospitals. We have a lot to do together, and we share also, I guess, the same situations, the same problematic conditions of our patients, and also of our people treating our patients. Then thank you very much, and I hope to see you soon. Bye.
Thank you, Pablo. Jeanne?
Thank you so much. Thank you, everyone. In the continuation of all of our actions, I just want to share a couple of things that we're doing right now, and to continue with what Dr. Galili was saying, to be more creative. We have an exciting challenge happening right now with Hadassah, which is the Hadassah Song Challenge, with the song Let Us Be Healed by Israeli artists Yair Levi and Shai Sol. The challenge is to make your own version or adaptation of the song, and the most original videos will win the chance to sing with the artists on Zoom, and this will be shared internationally. So this is a very creative challenge. I hope everyone will take the chance to do it. And I also want to mention that tomorrow we're having another very interesting Zoom event that will be on transformation and innovation in cancer research and treatment. We have 3 stars from Hadassah Hospital joining us for a panel, and it's going to be very interesting. Professor Aaron Popovitzer, Professor Michal Lotem, and Professor Polina Stepansky. It's going to be tomorrow, Monday, at 8 p.m. Israel, 1 p.m. Eastern Time, and 6 p.m. GMT. So we're excited to see you tomorrow, and have a good day, good afternoon, good evening, Goodbye, להתראות, au revoir, hasta luego, shalom everyone.
And once again, thank you, Professor Galili and Dr. Michanie. It's been a wonderful, wonderful event, and we expect to see you all in our next event at the Hadassah International Summer Summit.